Well, I have the pleasure of introducing Aki Smith, who I met many, many years ago, who is the co-founder of Hope for Stomach Cancer Patient Advocacy Group, and actually an tremendous force in patient care and advocacy. And all my patients that need support, I send to Aki and Hope for Stomach Cancer. So.
Thank you, everybody. It's such an honor for me to be here for my third time at the Gastric Cancer Summit. For those who don't know me, I'm Aki Smith, a caregiver, founder, and executive director of Hope for Stomach Cancer. Today, I'm excited to share my personal journey in advocating for patients, the importance of the patient voice, and our plans for continuing the journey in 2025. So I'm going to really quickly go over my personal journey, driving awareness and equity, building momentum through action, looking ahead to 2025. So a quick recap of my father's story. He was diagnosed in 2013. He was diagnosed with advanced stomach cancer and given months to live. However, through a restaging process at the NCI, we learned that he was actually stage 3B and HER2 positive. He underwent a challenging journey, including a full gastrectomy, chemotherapy, and radiation, and today he is still with us. So from that moment, I promised myself that if he reached remission, I would give back to others facing this disease. This has led to the creation of Hope for Stomach Cancer. So Hope for Stomach Cancer, building a foundation. Hope for Stomach Cancer was founded on a mission to bridge the gap between research and patient care. We recognized early on that there are very few resources and no standard treatment protocols. So what we do is we foster these through connections, building a supportive community, providing educational resources, amplifying patient voices through programs like 30 Stories in 30 Days, and we also do the Patient Empowerment Summit. So throughout my advocacy, I've seen the disparities in stomach cancer, whether they're based on age, socioeconomic status, geographic location, or race. These disparities act as barriers to timely diagnosis and quality care. For example, patients in remote areas patient in remote areas may not have access to a national cancer institution. To address these challenges, we've developed health equity solutions that raise awareness, provide navigational tools, and create support networks to help patients access what they deserve. So these are kind of our health equity solutions, and we raise awareness, we do outreach, we provide navigational tools, webinars, support groups, sharing stories, and of course our hope in the bag. So I'm going to quickly share my personal story and my risk. Alongside my father's journey, I also carry personal risk factors for stomach cancer. I have a family history of gastric cancer, and I tested positive for H. pylori. In 2020, I experienced symptoms myself, and after months of advocating for testing, I was diagnosed with chronic gastritis. This personal experience reinforces my belief in the importance of advocating for early screening and preventative measures. So this is just a little bit about my family history and my images, and then I also am on the Stand Up to Cancer team, and Dr. Andrew Chan, who will be presenting tomorrow, always reminds me that I am just a couple steps of developing diffuse type gastric cancer. So this is always on the back of my mind. So now about raising awareness. 30 Stories in 30 Days campaign. So today, the month of November, is Stomach Cancer Awareness Month. And so what we do is our 30 Stories in 30 Days, highlighting the real experiences of stomach cancer patients. This year, I've noticed something especially moving. Some patients diagnosed at stage 4 have had a parent who was also diagnosed with stomach cancer, even though there's no hereditary link, which was identified. So these stories remind me how crucial it is to advocate for early detection and comprehensive screening, as these can be the differences between early diagnosis and late-stage discoveries. So when I first spoke at Stanford in 2020, I realized that there really was no advocacy group dedicated to stomach cancer prevention and early detection. It was an incredible moment, and it sparked a vision in me to create the space for early intervention. From that day forward, I committed myself to advocating not only for treatment, but also for proactive measures to prevent stomach cancer so that we can catch it early. OVAC Advocacy Day and the Moonshot Cabinet. Taking this vision further, we participated in the OVAC Advocacy Day in March 2023, where we met with the Moonshot Cabinet at the White House. This was a pivotal experience that underscored the importance of policy change and strategic alliances. We left with renewed determination, seeing firsthand how patient stories could resonate in powerful ways with policymakers. You can see here, Lee, Michael, and Lauren were here with me, and they were very instrumental in sharing their experiences. In 2023, we held our first Patient Empowerment Summit in Los Angeles. It was a deeply emotional event with patients and caregivers coming together to share stories, learn from experts, and find community. This led us to expand on the East Coast, adding our first Advocacy Day in Washington, D.C. in May 2024. There, we brought the voices of patients and caregivers directly to Capitol Hill, meeting with representatives and sharing our stories. Our work culminated in the introduction of the Stomach Cancer Prevention and Early Detection Act by Congresswoman Caballero. This bill is a significant step forward as it addresses screening gaps and aims to make early detection more accessible. While the journey to enact this bill has been challenging, the widespread support we've received shows just how important this cause is. To further mobilize our community, we also launched the StomachCancerAdvocacy.org platform where patients, advocates, and families can unite and find resources. This site empowers our community to take action, share stories, and support each other, and also it's a go-to for anyone impacted by stomach cancer. And it also sends an email over to your congressperson. A highlight of our work was receiving a presidential proclamation recognizing Stomach Cancer Awareness Month. This milestone brought national visibility to our cause, and it has been given us a renewed energy as we head into 2025 with plans to continue this advocacy on a larger scale. Looking ahead, the elections and the new beginnings. As we look to 2025, we know there will be new challenges with elections bringing potential changes to Congress and administration. This may mean starting from scratch, but we're ready to face this. We are building a strong foundation with committed allies in Congress and a passionate community ready to push forward. So, looking ahead, I am filled with hope for what we can achieve together in 2025. Each of you here has a role to play, whether it's sharing your story, advocating for policy change, or supporting those affected by stomach cancer. Thank you for joining me on this journey, and let's keep pushing for a future where stomach cancer is detected early and lives are saved. Together, we can make a difference. To stay engaged and support our mission, I encourage you to register today at StomachCancerDC.org. Save the date for upcoming events, February 8th through February 11th, and let's continue to drive change together.